Pans and pandas may sound like a noisy bunch of black and white bears eating bamboo while banging pots and pans in your kitchen. To parents of these afflicted children, it can feel as though we are living in a madhouse. Their preteen, even preschool-age child, was growing up like all the neighborhood kids, but soon, after a seemingly benign strep throat or other infection of childhood, a switcheroo flipped. Little Johnny acquired odd behaviors with tics and twitches. Little Susie became unexplainedly anxious or depressed. Confident Jack began worrying about every germ within a mile of him. Carefree Beth could no longer sleep without nightmares and middle-of-the-night insomnia. While parents know that kids go through stages, these parents wait to no avail, and months later look back in hopes of identifying the wrong turn in the child's health. Various doctor visits assure them to wait it out, or consider some medicine, or try some child therapist. After months, and sometimes years, the parents reach the point of despair. As the child grows and becomes more aware that they are different, they may begin to despair of ever finding relief themselves. Functional medicine offers hope, as we know that root causes lie underneath the surfaces of these symptoms, and we know that resolving the identified root causes lead to relief and recovery and a healthier life. Pediatric autoimmune neuropsychiatric disorder associated with strep, PANDAS, and pediatric autoimmune neuropsychiatric syndrome, PANS, have big names and even bigger impacts, but share a common mechanism of damaging the brains of these children. As the name suggests, they share the mechanisms of autoimmunity, the dysfunctional process by which our normally protective immune system turns on our bodies and starts attacking us. In these disorders, the immune system turns on our children's brains and creates inflammation in brain areas necessary for thinking and feeling. This inflammation results in dysfunction of these areas, either turning them up or down, and thus the actual symptoms arise from what areas turned up or turned down. With dysfunctional nerve cells in these areas come abnormal levels of neurotransmitters. With different neurotransmitters responsible for different brain functions, the actual symptoms depend on which area and which neurotransmitter fluctuates out of balance. Excessive serotonin could cause manic symptoms, while low levels could lead to anxiety or depression. Abnormal levels of dopamine can lead to either loss of the ability to enjoy activities, paranoid symptoms, or even hallucinations. Changes in levels of catecholamines like norepinephrine and epinephrine, also known as noradrenaline and adrenaline, may affect attention and focus and energy levels. Children as young as those in preschool may go from normal to nightmare over a week, 2 weeks, or even a single night. They begin washing their hands to avoid germs until the hands bleed. They become so attached to a parent they won't go to school, or they obsess over a parent's risk of dying before they see them again. They begin having panic attacks at random times for no reason. They become depressed to the point of suicidal thoughts at times. They develop tics and twitches, weird repetitive movements they have little control over. All of this arises from this autoimmune inflammation damaging their brain cells. This autoimmune process was triggered by either an infection or maybe a toxin. Either of these triggers, or sometimes a synergistic combination of both, sets off a cascade where the nervous system mistakes the immune system mistakes the child's brain cells for the attacker. While the immune system fights the virus, bacteria, parasite, or toxin, it also harms the brain cells. Even after the trigger seems to fade out of the picture, the neuropsychiatric syndromes continue for months and years, often flaring when another infection comes along. Parents and the child's doctors are baffled and sooner or later despairing of ever seeing improvement or resolution. Functional medicine has answers that conventional medicine ignores. First, we recognize that this syndrome is real and your child's symptoms are not the result of bad parenting or bad genetics or bad luck. Second, we know that finding the original trigger or ongoing triggers offers a real opportunity to resolve both the inflammation and the symptoms and return your child back to normal. Third, we know what therapies work to remove the triggers and stimulate healing rather than continue ongoing damage to the brain and your child's future. We begin by looking for clues in the child's story, which suggest PANS or PANDAS. Sudden onset after an obvious infection provides the biggest clue. But not all children start out so obviously. Many times, the symptoms develop over a few weeks or are only recognized after an emotional crisis that breaks through the surface of recognition. Sometimes, the actual infectious trigger caused no symptoms in the child, but siblings were sick with strep or some other fever at the same time the child's symptoms began. We then look at confirmatory tests to identify the triggers that started and could be continuing the inflammation. Often, viruses continue long-term in our bodies with subtle symptoms, but no fever or other symptoms, to give away their presence. Often, the immune system reacts to other infections other than the original and cause neuropsychiatric changes with every virus or fever that comes along. Strep can recur and trigger a flare of the original emotional changes. At times, exposures to toxins like mold exacerbate the symptoms and indicate that a toxin is involved primarily or secondarily. When the history and the test point together to PANS or PANDAS, we target both the triggers and the actual inflammatory process. We employ natural, indoor, pharmaceutical, antivirals, or antibacterials to lower loads of these infectious triggers. We augment the immune system to prevent future recurrences of these infections. We remove toxins through various means, depending on which type of toxin is involved. We activate the child's anti-inflammatory and healing mechanisms to turn off the brain inflammation and return the child to optimal brain health. With this approach, we see these children and their parents not only regain hope, but return to a healthier, more abundant life that they had both hoped for. This process can take 6 to 18 months and requires support therapies to get through the early rough seasons. With some time and cooperation between us and them, we see success. PANS or PANDAS is not a life sentence when the root cause is identified and properly addressed. With that, let's take time to answer questions and discuss this important issue.